Monday Health Minutes, sponsored by Valley Health.
Hi, I'm Melanie Shafer. Welcome to Monday Health Minutes with Valley Health. We're excited to announce the addition of specialized cardiologists and expanded cardiovascular services at Valley Health. Today we're talking with Dr. Dan Snavely, the Section Chief of Cardiology Services at Valley Health's Heart and Vascular Center. Thank you so much for being here.
Thank you, Melanie.
Let's talk about what kind of services are going to be available at Valley Health with this new service line.
Sure. So we will have the full spectrum as far as clinical care at Valley Health Cardiology. We will have general cardiology, interventional cardiology, heart failure, and vascular specialists there. We will have routine office visits, consultation, preventative care, congestive heart failure, women's services, preventive and diagnostic services. So that's and more than that as far as our level of expertise. But the testing that we will do there specifically, routine testing as far as EKG, we will have stress testing, echocardiograms, nuclear stress testing, vascular testing, meaning carotid ultrasound, abdominal ultrasound. We will also have basic radiology services and laboratory examinations there as well.
So this is really a one-stop shop for everything cardiovascular-wise.
Yes, ma'am. We will not have coronary CT angiography there, but that is well offered in the area, and we did not want to saturate the market with that testing at this time.
So what does this mean for patients, having this new option available at Valley Health?
It will provide service to the existing Valley Health patients so they don't have to travel. It will keep it within their network so their providers will be able to have instant access to the results. And beyond Valley, other patients from outside the Valley system are more than welcome to come in to see a specialist or have the testing done.
Right, so it is open to everyone.
It's open to everyone.
Yeah, and to get an appointment, is that difficult?
No, it's not difficult. You don't have to have a referral. We will take all comers, and that's really the benefit of this Valley Community Health Center, that they take all comers, and so will we. Now you will need appointments or referrals for specialized testing, but not to see a provider there. You do not need a referral.
What would you tell people who are worried about their heart health? Is it time to just investigate? Should they see their primary care provider first, or what's the right step to investigate whether something's going on?
That's a good question. I would say for the average person in our area, as you well know, we are riddled with heart disease in Appalachia. Most people are higher risk than I would say in some other area. But a very low-risk patient can see their primary care provider and start there with basic screening, blood pressure, cholesterol, glucose. But anyone that would be considered intermediate or high risk, then I think they should see a cardiologist to establish care before something happens. And then we can guide them on the next steps.
So what would determine if someone is low, medium, or high risk?
Yeah. So high risk would be family history of premature coronary artery disease. Either mother or father having heart disease in their 50s, a sibling that may have had heart disease at a young age, or if they have high-risk indicators such as diabetes, very high cholesterol, high blood pressure, or smoking, or any concern that they have, any symptom that may seem unusual for them. Those people I would consider high risk.
And go right to the cardiologist.
And go to the cardiologist and get an evaluation.
Well, it's exciting to have these new options offered. What other advice would you give to people?
Pay attention. American Heart Association several years ago had this campaign that said know your numbers, meaning blood pressure, cholesterol, glucose, and that's one thing I would say, know what your risks are. And also pay attention to symptoms. Sometimes I have people that will say, well, I was short of breath. Starting in January, I'm going to an exercise program, New Year's resolution. Well, I was short of breath and notice something unusual, maybe not the classic elephant on your chest, but just some type of symptom is unusual for you. Pay attention to that. If you're concerned, listen to your inner voice. That's what I would say.
And pursue it. All right. Dr. Dan Snavely with Valley Health's Heart and Vascular Center. Thank you so much for being here. We sure appreciate it.
Thank you, Melanie.
Thanks for checking in with Monday Health Minutes.